Some people have formed the habit of taking antibiotics like their vitamin C. Any small high temperature, you're feeling feverish, hotness or whatsoever, maybe your temperature just changed small. You go and buy 6 sachets. You add injection on and join. Just because you want to, some people will say, I no want sick, so make a drink am. Forgetting that misuse or abuse of antibiotics is harming you rather than treating the reason why you're taking it. Well, this is what we'll be discussing today on Health of Law, brought to you by Lifeway Medical Diagnostic Hub. This is where we discuss, we dissect important health-related issues that matters to everyone. So we're talking about antibiotics misuse and resistance, how it affects your system, how it affects your health and everything. My name is Amazing Rita, and with me in the studio, Dr. Dimba Favor. Hi, Dr. Favor.
Hello, Lisa.
Today I pronounced it very well.
Exactly.
Clear.
I'm so glad.
So, Dr. Favor, what is antibiotics, and medically, what is it supposed to be used for?
Okay. Antibiotics is a group of medications used to treat infections. In fact, not just infections, or let me put it this way, it's a group of medications used to either kill or slow down the growth of some microorganisms.
Okay, so it's to kill and slow down. That means the microorganism is already present in the system.
Yes.
When we not kill or slow it down.
Slow the growth
Or,
down.
okay, slow the growth down. So how do they work in the body?
They work by different mechanisms.
Okay.
There are different classifications and different classes of antibiotics. Yes, they work with different mechanisms. But generally, they aim at either killing the organism or slowing down its rate of progression, growth, or reproduction.
So why are antibiotics more effective with bacterial infections than the rest? But something like common cold, flu, catarrh, cough, doesn't work. Why?
The reason is this: common flu, not all types of catarrh, not all coughs, could be from viral sources.
Okay.
Could be from viral organisms, viruses. Yes. And most viral organisms, most virus that cause infections or what have you, those infections are usually self-limiting. What do I mean by self-limiting? The body can handle them.
Okay.
However, another reason is this: microorganisms. Why am I saying microorganisms? Antibiotics have, like I said, they have different mechanisms of action. Yes. So one of them is this: bacteria have cell wall covering them. However, viruses have no cell wall. And then one of the mechanisms of action, one of the ways through which antibiotics work is that they act on the cell wall. So imagine a virus not having a cell wall. The antibiotics has nothing to act on. And like I said, most times our body is able to produce antibodies that can handle these viruses. Yes, that's why I say most viral diseases, most viral organisms that cause diseases are self-limiting.
Okay, so what is antibiotics resistance?
Antibiotics resistance is when, I'm just going to explain it in a simple term.
Okay, in a layman's term.
Okay, antibiotics resistance is when this organism now is present in the body. These antibiotics normally should handle it, but when you give the patient these antibiotics, is no longer capable of handling that microorganism. Do you understand? Let me say previously it could destroy this microorganism, but now you're giving that same antibiotics and it's no longer able to do its work. Even after the patient takes the antibiotics, the organism will still be present. At that point, you would say this organism is resistant to this antibiotics.
Does it in any way make the organism stronger?
It's not like it's making the organism stronger,
okay,
but
because it's still present.
Yes, the organism it has just found a way to evade, like to dodge what the antibiotics will do, such that even if the antibiotics is taking, it will still be alive because these antibiotics can, like, it has found a way to shield itself from the
Dodge.
exactly from the effects of the antibiotics. So that's what happens. Not like the antibiotics is fortifying it to be
Okay,
stronger.
okay. So, is can one antibiotics cure every bacterial or viral infection?
No, no. We have, there are different classifications of antibiotics, but one of the classifications is the broad spectrum and the narrow spectrum.
Okay.
Broad spectrum antibiotics can, they can work on a large group of organisms. They can handle a large group of organisms. However, narrow spectrum can handle just particular organisms. And then one antibiotics cannot handle every bacteria. There are different antibiotics for different purposes.
So why do people assume that antibiotics can cure everything?
Like you said, it's an assumption. And then let me say sometimes coincidences occur. Let me
Okay.
say maybe this Mr. A was having this symptom, he took these antibiotics, and then somehow let me say it just went.
Yes.
So he, you won't really, okay, like this example I'm trying to paint now. Mr. A was having this symptom, he took these antibiotics, and then he felt better. To him, he will link it up to the antibiotics that made him better. But it could be that his body on its own, his immunity just fought against the offending organism, and then he felt better.
Yes.
So people just, like you said, it's an assumption. People just assume within themselves that this antibiotics can handle everything, but it's not so. There are some conditions where you give antibiotics and then the person, there's no change. This condition does not require antibiotics, rather you need another line of management.
Okay.
Yeah.
What happens when someone takes antibiotics and they don't finish it?
It's a form of abuse. Reason that's not taking it based on the prescription, like maybe it was prescribed for 7 days and the person just took for 3 days.
Yes.
It's a
Or
form of,
probably took for 3 days
okay,
and left the rest.
It's a form of abuse, and this is one of the reasons why the person can develop resistance to it. Next time, when the person is using that same medication to achieve the same purpose, the organisms by then they've already found a way to protect themselves from the effects of that antibiotic. So such an instance is a form of abuse that can lead to resistance.
So can people take antibiotics without prescription? Because like I told you when I was starting the video, I told you that starting the episode, yes, I said that some people feel like, okay, because it's been long I took antibiotics, it is the time for me to buy and take another one so that I can fortify myself even without any symptom or whatsoever.
Okay, so your question is
If taking it without prescription, is it a form of abuse?
Of course it is, because it wasn't prescribed to you by healthcare. Remember, I know we once had a session where we talked on self-medication. Yes, and then we described self-medication as the use of any substance at all to that was not prescribed by a doctor, not taken under the prescription or under the supervision of a doctor in order to achieve a purpose. So someone going to get antibiotics without anybody's the supervision, prescription of a doctor is equally abusing antibiotics.
Can it affect the person's immunity? Like you're trying to fight against, okay, because I've noticed some people will be like, I was strong when I bought this antibiotic, and then I took it, and then I started feeling feverish.
Okay, it's not like it's fighting against their immunity, but it is that, remember I said one of the mechanisms of action of antibiotics is either to kill the organism, some slow down the progression or the multiplication of the organism. So when an organism, maybe the antibiotics acts by killing, when it lyses the organism, it releases. Imagine now you get what example can I give? You get an insect and then you crush it. If it had some toxins in it, it will be released into, like you will see it. So when an organism is lysed, when it's broken down, when it's destroyed, some of the toxins or whatever is released, where before it will now be excreted. or sent out of
Out.
the body. So all this, the release of the toxins and everything into the system before it's sent out of the body is what gives those symptoms of malaria where the person starts to feel unwell.
Okay.
Not that the antibiotics is working on the immunity and bringing down the immunity.
So, what happens in the body when someone um, takes a leftover antibiotics?
That is equally another form of abuse.
Abuse.
Yes. First of all, this person would not be taking the complete or adequate dose
Mm-hmm.
that should work for him or her.
Mm.
Remember, it's a leftover
Yes.
antibiotic. And secondly, this person is just taking it on his or her own. Do you
Yes.
understand? Except the only time where you can say that can work is maybe this is patient A, she has gone to the hospital, she saw a doctor, and then she had maybe upper respiratory tract infection. The doctor said you should take azithromycin for 7 days, gave her a particular dosage and told her to take it for the duration of 7 days. And then she got a card, and that card can serve for just 5 days, and possibly there's azithromycin in the house that
It's
was
remaining.
remained by
Yes.
someone. She can use it to make up
Up
for
for
the
that.
7 days.
Okay.
In
Okay.
that instance, you won't call that abuse
Abuse.
because she's taking it based on prescription of a healthcare provider. Yeah. But in a situation where he or she's just going on his or her own and then taking a leftover antibiotics, first of all, that person is exposing himself or herself to resistance, and then the person is equally abusing the medication.
What do you think about people trusting? I won't call them pharmacists now.
Okay.
Chemists. What do you think
Okay,
about people
thanks,
trusting
drug
them?
dealers,
Yes.
chemists.
To prescribe drug for them.
Then I feel the reason people do this is maybe ignorance. One, they're ignorant of the fact that this person, they just feel like this person sells drugs, so the person should know
No.
what should work for me. So that could be a reason.
And
Secondly,
most times it's trial and error.
exactly, yeah, but they just have this mentality. Since he's a drug shop owner, he would definitely know what to give me
Prescribe.
for me to get better. Another reason could be this: when they're trying to save costs, they don't want to go do the right thing, go to the hospital, maybe pay for investigations, and then they want to save costs. Another reason could be maybe proximity. When they see that the distance of the hospital is very, very far, and then this is just a drug dealer close to me. Why not I meet him? He gives me medications, and then possibly maybe he has prescribed or given medications to someone in the past, and then he worked. So this person will feel secure, will feel that even if he prescribes for me, it should equally work. So these are some reasons why some people trust patent drug dealers or chemists on their prescriptions.
Is there anything like stronger antibiotics? Like this antibiotics is stronger.
Anyway, there are antibiotics that are very potent,
Okay.
very strong, very
Okay.
efficient. But potency is the word I would like to use, yes. And then just like when you're treating something, you don't just go and start with the strongest or the most potent.
Okay.
Yes, it's a stepwise thing. When like like I said, there are different cases that require particular antibiotics. Do you understand? You can go get that very potent one and then you're using it for a particular case which is not meant to be used for, and then you won't get optimal results. So in essence, yes, there are very potent antibiotics. Just like when you go to get them, you see that their prices are actually very high. They are very potent antibiotics.
So, like from what you just said now, it's actually not advisable. Anyway, it's not even advisable to buy it by yourself.
Exactly.
But this whole thing of saying you go to a chemist and then you are looking for a strong antibiotics, you might be harming yourself. If I'm going
Exactly,
by
it's
yourself, it's
not
harming
ideal.
yourself.
And another catch to it is this, because like I said, it's a stepwise thing. So in an instance where someone maybe has been abusing this particular antibiotics, The next time the person is to take that antibiotics, because the person, whenever the person develops resistance to it,
Mm.
next time the person is to take it, it won't work. So you need to use something higher,
Mm.
or another one that the
Mhm.
organism is sensitive to.
True.
So if someone just keeps going to the pharmacy or to the chemist or wherever, telling them to give me very strong antibiotics, it will get to a point where the person may get resistant to all antibiotics,
Wow.
and that is a very difficult situation
Point.
for oneself to be in.
What about combining antibiotics and herbal medications or painkillers? Would it make it more potent?
Not at all. Painkillers, like you said, they are painkillers.
Okay.
Antibiotics are not used as analgesics,
No, no,
so
no,
they
just
won't
to
make you.
make it just to make it like a stronger antibiotics.
Not at all. It doesn't work that way.
Okay.
That's not how it works. Possibly the person was giving antibiotics and painkillers because they want to. The antibiotics, remember, I said, is used to either kill, slow down. It has its own mechanism of action, but antibiotics can never do the work of analgesics.
Okay.
But then for herbal medications, I don't know, it's totally out of. Why will you be taking antibiotics and be taking herbal concussion? Why herbal medications? They are harmful to the organs, so they don't even
They cannot make the
add up.
antibiotics stronger.
Exactly.
Okay. Some women can pregnant women safely take antibiotics?
Not all antibiotics. That's why a pregnant woman should not on her own get antibiotics and take, because some antibiotics are teratogenic. Example, tetracycline. Tetracycline, when taken during pregnancy, can cause discoloration of the teeth. It causes yellowish discoloration of the teeth, and that's just an example. Some other antibiotics they can cause harm to the fetus in utero. So a pregnant woman should not just go there, get antibiotics for herself on her own without the prescription of a doctor.
Okay. So let's talk about people that, like, we're talking about this using it without prescription.
Yeah.
Can it turn a minor something like a minor infection or the rest to a life-threatening condition?
Yes, it's possible. The reason I said it's possible is this. Imagine a patient having a urinary tract infection or an upper respiratory tract infection, going to meet a chemist or a patent drug dealer and telling the person, please give me medications or antibiotics. These are the symptoms I'm having. And then the patent drug dealer or pharmacist or chemist or pharmacist goes ahead to prescribe medications, including an antibiotics, and then that's not the actual antibiotics to use for the condition. You see that the person takes the medication but is not getting better. And before you know it, this infection can get into the blood, leading to what is called sepsis. And then sepsis could be life-threatening and what have you.
So apart from the fact that you notice that the antibiotics is no longer working for you, are there other signs that will show that you are now being resistant to this particular antibiotics?
Not like there are signs really, but then the person would see that despite taking the medications, I'm not improving. Despite taking these medications for upper respiratory tract infection, I'm still coughing, I'm still having chest pain, I'm still having nasal congestion. So that could be one of the things you would see to tell you that this person is not responding to these antibiotics.
What about health problem, like some health problem? Can the misuse, abuse, or antibiotics being resistant to a person, can it cause other health problem for them?
Not like it's causing other health problems. The only thing I can explain, if it's an infection that was to be treated, it could further progress to something that is more life threatening. But apart from that, I don't think it would cause any harm to. I don't understand the question really.
If it would cause, and like because of the fact that the antibiotics I'm taking, I'm being resistant to it, and I'm still taking it.
Okay.
Is there something it can cause?
Not like it will really cause anything. It's just that the person is already resistant to it, so the antibiotics cannot help the person to achieve anything. But the bad part of it is that the infection will persist. All the symptoms the person has been having will persist, and possibly they will get worse because these drugs the person is taking is not helping. So it's just like the situation is just there, untreated, unhandled. You're not doing anything about it because despite the fact the person is taking these antibiotics, the antibiotics is not working, it's not doing anything. So it's just like the symptoms are left unattended to, so it worsens with time.
Let's talk about poor healthcare system being one of the reasons for the misuse of antibiotics. So, in a situation where you have an emergency
Yeah.
case
Okay.
and probably access to health to a proper healthcare system is not there,
Okay.
what should the person do?
An emergency case, is it like the person is at home and then the person has an emergency, or
The person probably has been feeling feverish,
Okay.
and because of the fact that they don't want to abuse antibiotics, they've been planning that we will soon go to the hospital,
okay,
and then it becomes an emergency situation.
obviously the person will still need to go to the hospital, because if the person decides maybe there's a chemist close by, let me go, and at that point for the person to have been procrastinating is already very wrong, because there's a term we call it in medicine, like attending to symptoms as quick as possible,
Okay.
or as early as possible. One of the things we advocate for in medicine is as soon as you notice the symptom, you should report or see a doctor. Don't wait till it progresses and gets bad. For them to have procrastinated that long, it means they've defaulted already. So further going to get medications from a chemist, they are further defaulting, because they could get something that will even worsen the situation. So at that point, they should go to the hospital.
So why should people, lastly,
Okay.
why should people not abuse antibiotics?
People should not abuse antibiotics to prevent them or to stop them from getting resistant to antibiotics. There's a particular patient we once saw. He came with very high fever, he came with some symptoms, and then when we did his urine MCS, that's the microscopy, the culture, and the sensitivity, all the antibiotics that were tested for, he was resistant to everything. And at that point, we were very stuck. It's a very bad thing for one to be found in, because you won't really know what to do for this patient, because everything they've tested for will not work for that patient. So that is a very bad condition for oneself to be in. So we should try not to abuse antibiotics or take them without prescriptions in order to avoid
Right.
resistance.
Okay.
Yeah, because when the person gets resistant to it, not only will there be nothing else to use, another thing is that even if there is, it will be something that will be more expensive. So this was something that could have easily been achieved with a cheap antibiotics, but because this person has abused it over time and is now resistant to it, you need to step up to use something higher to get results.
Thank you so much, Dr. Favor. Like you said, one of the benefits of not abusing it is that if something that's, let me use for example, a 3,000 naira antibiotics would
Could
have
solve, yeah.
worked for you, and then they're looking to get you. And then when you go to the chemist and the pharmacy and you say, give me strong antibiotics, just know that by abusing it, you're already upgrading in the financial realm of buying
Because if
antibiotics.
eventually he or she gets resistant to
So
that
that
high
strong one,
they will
you
need
look for something
higher or
stronger.
stronger, which will be more expensive.
Which will be more expensive.
So to this, like, avoiding abuse helps to save costs, to save everybody,
life.
exactly, to save everybody from thinking, what do we now
What do we
use
do
to
next?
treat this patient's symptom?
So just find your way to the hospital. It's that simple. Try to see a doctor. Talk to a doctor. And even if you get one and it's not working, don't go and get another one.
Exactly.
Go to the hospital next, because you are just complicating the whole issue. So try and go to the hospital so you know, so that the doctor can prescribe what next you can get for yourself. Thank you so much for hanging out with us on Health Unplugged. Remember to share, like, drop your comments. If you have any question in the comment section, we would attend to it as it comes up. And then we'll see you next week. My name is Amazing Rita.
I'm Dr. Dimba Favor.
And from us, it's bye.
Bye.